Really, I think the best place to go in this day and age is really to focus on our medical specialty society guidance. The American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the Infectious Diseases Society of America, the American Academy of Family Physicians, all have developed evidence-based guidelines around the respiratory viral vaccines. And most of those guidelines are based on a solid evidence review done by a group called the Center for Infectious Disease Research and Policy out of the University of Minnesota. And that background data is available on their website. And a manuscript is actually in preparation that should be out here in the New England Journal in the next couple of weeks. So particularly with where we are at present with the government shutdown, there's not a whole lot of national or regional epidemiologic data coming out of CDC. And we all know about the challenges with CDC staffing and direction. But I would hope that we're starting to see a beginning of some data coming out from state and local health units. I would hope that large hospital systems will make some data available on trends in respiratory illnesses in their communities, testing results, percents positive. That can help us to know what we're dealing with in our local areas. We need that information to help drive the messaging to our healthcare professional teams as well as to our patients to get those flu vaccines done, to get our COVID vaccines done, to get RSV vaccination done. Our vaccination rates were not great last year. And coming out of the worst flu season that we've seen in over 15 years, we can't take the chance of having even lower vaccination rates this year and having even a greater community impact. The goal of our It's On Us campaign is to help reinforce to us, we are the trusted voice for our patients. Despite political opinions, despite the misinformation envelope, studies continue to show that a healthcare professional recommendation has the greatest impact on getting people vaccinated. So it's on us to make that case for our patients. It's on us to vaccinate our teams. It's on us to make vaccination the norm to reduce the impact of these respiratory viruses on our patients. First and foremost, we want our whole healthcare team vaccinated, and we want to make sure that that's known. What you might do is put on your front desk, we're all vaccinated. We want you to have the same level of protection. The simple little messaging to help people know that vaccination is the norm in this practice. Be willing to speak to your local media. Be willing to speak to community groups, to talk about why you do what you do to help protect yourself, your family, your team, and your community. First and foremost, these diseases are not going away. Viruses have been around far longer than humans have. Let's do what we can to protect our teams and our communities. Vaccines are safe. Influenza vaccination every year is important for everyone 6 months of age and older to reduce the impact of influenza to adults and children. COVID-19 vaccine, much as the misinformation is out there, is safe and effective. The only serious adverse event that's been seen with any regularity has been mild myocarditis in young men. And that's very uncommon. One case in tens of thousands of doses of vaccine. The vaccine does reduce the risk for severe disease and hospitalization, does reduce the risk for disease, and it does reduce the risk for long COVID, all important outcomes. We now have new tools to prevent severe RSV disease in our older adults and in children. So getting people vaccinated with those is important. And finally, to pneumococcal disease, we now recommend pneumococcal vaccination for all adults 50 and older, in addition to all of our children and younger adults who've got chronic health conditions. Let's use that tool to reduce the impact of these diseases in our patients.